Now, here's your host.
Welcome back. I'm Larry Patton, and we're delighted to have you as a part of Public Report Today. With us today is Dr. Jason Huff. He is a medical oncologist, Emerywood Hematology / Oncology, a Cornerstone healthcare provider. Did I get all of that right?
Yes, that is correct.
That was kind of a mouthful. Good
That
to have
is,
you
yes,
with us
yes.
today.
Thank you. Thank you for having me.
You know, we're talking about a fairly serious subject here.
Yes.
In fact, it's often called the big C.
Right.
And oncology deals with?
Oncology deals with the treatment, diagnosis, and management of cancer. And as you know, cancer comes in many different forms, unfortunately, and affects too many Americans these days.
Mm-hmm. And you chose to specialize in oncology. Why?
You know, it was the patients, really. I trained just down the road at Wake Forest University Baptist Medical Center in Winston-Salem.
Mm-hmm.
And there's a very large cancer center affiliated with Wake Forest. And so as house staff, my internship and residency, I had the opportunity to be on the wards in the hospital with a lot of cancer patients. And you know, during that time, this was the early 2000s, I could see that there was ultimately going to be a change in the treatment and management of cancer, and it became very exciting to me. The big C, so to speak, was becoming less of a death sentence, and I think in many cases now we're looking at managing cancer as a chronic illness. And so whereas we looked at it as a diagnosis and a 6-month or a year survival, we're seeing, you know, years survival in many cases with cancer. And so that really, the science and the patients were what drew me to become a medical oncologist.
And people in my generation, quite honestly, have considered it the death sentence.
Yeah.
And having 2 children go through this in the past couple of years, I have been overjoyed to discover the progress that has been made, quite honestly. Yeah. Colon cancer is a very prominent term that is used because of, I assume, the number of times it is discovered.
You know, cancer, cancer of the colon and rectum is one of the top 3 diagnosed cancers in the United States and one of the biggest killers as well. This is a disease that really has, our thinking about colon cancer has come a long way in the past 10 to 15 years. And the way I like to think about colon cancer is that it's eminently a preventable disease. This is a disease that we went from detecting colon cancer in its early stage with checking for hidden blood in the stool, and flexible sigmoidoscopy, which looked at the sort of the last third of the colon, to now using colonoscopies, which are a well-accepted screening tool for colon cancer that are covered by most insurances, are recommended by most medical organizations, where we're catching cancer in its precancerous form, really those polyps. And so, you know, not only has the diagnosis and prevention of colon cancer come a long way, you know, we could go into, you know, what we've done from a surgery standpoint to improve survivals, from a chemotherapy standpoint to improve survivals in patients who've been surgically rendered free of their cancer, or in those patients who unfortunately had their cancer show up at a more advanced stage, in the unfortunately incurable stage. We're able to manage that more as a chronic disease with treatments that are well tolerated. You look back into the beginning of chemotherapy in the 70s and the 80s with our first chemo treatments, and I think most viewers would remember a grandmother or a family member who got a chemo, lost all their hair, threw up for a week, you know, ended up in the hospital, you know, very poor quality of life. And today, really, we're seeing better medicines for supportive care. Chemotherapies are more tolerable for patients, and also our chemotherapies are becoming more targeted at the actual malignant cell rather than harming the innocent, healthy cells around.
Sure. Now, you mentioned the 70s. Are you saying that most of these advances in diagnosis, cancer has come since that time or prior?
I think we can see that in the 70s and 80s was really sort of the birth of cancer treatment for solid tumors. And when I say solid tumors, breast, lung, colon being sort of the primary ones that we think about, the ones that affect most Americans. With chemotherapy advances, the studies that we sort of base our treatments on were acquired patients into clinical trials in the 80s and then up into the 90s. So really now, since the year 2000, since I really started seeing cancer patients, it's almost as if we hit an exponential curve with regards to new chemotherapeutic agents, new understanding of cancer, and really what makes cancer cancer. We know now that not all lung cancers are created equal. There are genetic variations and changes within one cancer to another that may make it more susceptible to one specific chemotherapy regimen or targeted agent versus another. The same holds true for breast cancer as well as colon cancer. And my hope is that as my career progresses throughout the decades, hopefully, we'll see even further advances.
So now, are you saying that those advances are continuing at a fairly rapid pace?
Yes, they are. Yes, they are.
So that curve, exponential curve, is still in effect at this time.
That appears to be anyway.
One of the questions is that is cancer preventable? We're talking about some pretty serious issues here.
Right.
What steps do we take to prevent it?
Prevention really is the key. And when we look at both men and women, the top 3 cancers, breast, colon, lung, we could look at each of those individually and think about the things that could prevent any of those cancers from coming. And if we start with lung cancer, smoking. I mean, smoking and smoking-related problems that's the #1 reason that people get lung cancer. Breast cancer, we believe obesity, lack of exercise, hormone replacement therapy, we believe, has a role. So those can reduce a woman's risk for developing breast cancer. Colorectal cancer, family history and getting early screening can prevent. We believe that diet high in saturated fats, lots of organ meats tend to increase the risk of colon cancer. Smoking may increase risk of colon cancer. So there are steps that each of us can take to try to reduce our chances of developing cancer. There are things, though, that are just within us that are going to give us an innate risk of cancer, and it happens to people who live their life perfectly, and those are the heartbreaking ones. I mean, every cancer is heartbreaking, but when you see a patient who's lived their life perfectly and has had this happen to them, you know that there's something deep down inside that just put that patient at risk that they may not have had any control over.
Is that genetic disposition, or is that
likely
lifestyle?
Yes, likely. It's probably a combination of both, but we do know that cancer in some cases takes more than one hit, so to speak, to lead to the development of a cancer that grows and thrives within the human body.
We kind of get a laundry list of the various kinds of cancers that we can contract. Is one harder to treat than another?
There are some cancers that are more difficult to treat. There are cancers that have worse overall prognosis. Pancreatic cancer, primary liver cancer being 2 that come to mind. I think that of the more common cancers that we see, that we've talked about, it's those cancers really that have been neglected by the individual that are the hardest to treat. And there are lots of reasons why a person may neglect. I think neglect is kind of a rough term to use, but you have a problem and you explain it in another way, and you don't go see your physician about it. You don't get it checked out. Maybe insurance is an issue, payments an issue, and those are really viable concerns, especially with the economy the way it is these days. But the focus that we want as cancer physicians is to see people get regular screening, get problems checked out, things that don't get better, that don't have an explanation. A cough that doesn't get better, that is unexplained, that's still there 2 months later. Blood in the stool, coughing up of blood, a lump in the breast, things like that. Because cancer in its early stage is curable. You know, most any cancer in its early stage is curable. But once that cancer has had the opportunity to grow and spread, that's when it becomes incurable by scientific means, and we have to look at it as a chronic illness. And that ultimately then, you know, will lead to a patient's demise from cancer. So that's a long-winded answer, I guess, to say that any cancer can be difficult to treat. It's just the circumstance surrounding the diagnosis really that dictates that.
Assisting in the detection. One of the things that I've noticed that is fairly common with the people I've dealt with, having served as a pastor for 25, 30 years, in addition to what I'm doing now, I don't want to be called a hypochondriac.
Yeah.
So any deviation from the normal,
Right.
I feel like I can handle, and ultimately it'll come out on the other side okay.
Right, right.
But if people would respond to deviation from the normal and get some attention right away,
Yeah.
that's important.
I think that is. I think your point is very valid in that you don't want to hurt your elbow and then immediately start thinking cancer. You know,
Exactly.
You don't want to cough once and then immediately think you have lung cancer. But I think you need to. What I always tell my patients is that cancer doesn't get better. You know, symptoms from cancer get worse, not better. I think there are those warning signs, though, that should always immediately warrant a checkup from the physician. In a woman's case, a lump in the breast. In any person's case, blood loss in the stool, coughing up of blood. I mean, those kind of things really should alarm anyone. That, you know, if I can't explain it, you know, that's a problem. So
Don't hesitate. Get some information.
Absolutely.
The reason I'm jumping in here, we want to give people your website, which is GMKTG at, let me go it again, GMKTG at triad.rr.com. That's your website, that's your email.
That's an email address, yes.
Okay.
Yes.
You have a website?
It would be cornerstonehealth.com.
Okay.
And from that website, then you'd be able to link to our cancer center, Emerywood Hematology and Oncology, and get
And
lots
the phone
of
over
information.
there is what?
It's 802-2500.
Okay. Been great to have you today.
Thank
Wow,
you.
we could talk on and on and on. At least you could. I wouldn't have that much information, but I have a lot of questions.
All right, I appreciate that.
And I appreciate you coming by and sharing with us today. And please come back and talk to us again.
Absolutely, absolutely. Thank you.